Hello, my name is Esteban Yánez and my group is also formed by Esteban López and Sebastian Árias. We have chosen medical diplomacy in Cuba, which we are going to talk about next. For almost 6 decades, the Cuban regime has exported temporary workers to Latin America, the Caribbean, Africa, and Asia. Outlets, 85 state-owned companies in Cuba sell export service under bilateral government-to-government cooperation. Agreements are between the Cuban government and companies based abroad. According to Cuba, 75% are health professionals, the rest are sport coaches, architects, geologists, musicians, sailors, construction workers, and many in other capacities. The Cuban government refers to them as collaborators or cooperators, although in certain contexts it calls them proletarian internationalists. Medical diplomacy in Cuba is one of the foreign policy assets. Its strategy, accompanied by the enormous success its health system has allowed Cuba to gain international prestige and political capital. Their reputation is recognized even by the United States governments, and it is known globally that they provide medical assistance to anyone who requires it. Since the beginning of the Cuban revolutions, the government of that country has adopted a policy of medical diplomacy. He used of this diplomacy whether for humanitarian reasons or to win the heart and minds of the beneficiaries, has spread over the year. In addition to providing aid in cases of catastrophes and emergencies, Cuba began to provide direct health care service in many parts of the world. Who chose this diplomacy? Because Cuba has become an eminence in the field of medicine. In 2015, it spent 11% of GDP on the health system and approximately 0.4% on medical research and developments, one of the highest rates in Latin America. Its statistics on infant mortality, malnutrition, and life expectancy continue to be among the best in the region. Cuba receives several foreigners to train new doctors and specialists in the field of the health. In addition, Cuba has mobilized aid brigades to provide immediately assistance in many of the Great War catastrophes. Medical brigades were sent to China after the May 2008 earthquake, Indonesia after the May 2007 earthquake, Bolivia after the February 2008 floods, and Peru after the December 2007 earthquake. In the past, Cuba has also provided it helps Armenia, Iran, Turkey, Russia, and Ukraine, and most Latin America countries that suffered from natural and human disasters. For example, for 10 years, 18,000 Russians and Ukrainians received the free treatments in Cuba for disaster that arose after Chernobyl. We chose this diplomacy because it has such a global impact and how well it has been on track for several decades. Prevention and solidarity are one of the values of the Castro revolutions. Sharing and giving supposedly defines Cuba's health policy. With the international brigades, Cuban doctors have saved millions of lives around the world since its foundation in 1965. Cuba is a mysterious island, hit by an unprecedented economic crisis, abandoned by the tourists who ensures its survival, poorly equipped and isolated by a blockade as old as its revolution. It has nevertheless managed to control the COVID-19 epidemic and provide medical assistance to the rest of the world, a world as we can see in the following video.
The coronavirus outbreak may be overwhelming the healthcare system in many countries, but Cuba has so many doctors it's been sending them to help abroad. Known as an army of white coats, Cuban medics have been deployed to nearly 40 countries across 5 continents since the pandemic began. offering a type of medical diplomacy that far outweighs its stature as a small Caribbean nation of 11 million people. They're providing essential services in places like Peru, which has the highest death rate from COVID in the world. Cuban doctor Juan Pablo Falcon says it's clear they're needed.
Cuban doctors come to help. We don't want to replace anyone's job. To be honest, this country needs doctors. In spite of doctors training every day, doctors are needed and experienced health workers are needed so that they are able to train younger health workers.
Since its 1959 leftist revolution, Cuba has been sending its medics to help in disasters and disease outbreaks, such as Ebola in West Africa and cholera in Haiti. President Donald Trump's administration launched a mission against Cuban medics in recent years, citing exploitative labor conditions. Though Cuba experts say while some of the US criticism is legitimate, Paul Hare, former British ambassador to Cuba, who lectures at Boston's University's Pardee School of Global Studies, says most of the world looks favorably on Cuba's medical diplomacy.
Before some bigger countries who then realized there were public diplomacy advantages in offering equipment and personnel, such as China and Russia and other European countries. So the Cubans showed themselves prepared and adroit in deploying cadres very quickly. The question is whether this will be a long-term advantage for them beyond the pandemic and elsewhere. But Cuba is seen very differently in most countries' eyes from how the US administration.
Cuba has reported just 4,684 cases and 108 deaths so far, a tenth of the global average per capita. While Cuba has a surplus of medics, there's a shortage of food and medicines in the country. Its economy has been badly affected by a lack of tourists since COVID, a drop in aid, and a US embargo on visitors and commerce. But its medics are seen as heroes by both Cubans and the people they're helping abroad.
Addressing its impact, what began as humanitarian aid to a neighbor country ends up being one of the fundamental pillars of the island foreign policy, and today represents one of the largest medical cooperations missions in the world. Starting from its beginnings, we seek to show the current scope of the policy in the international arena, while at the same time we consider the different symbolic and economic consequences it can bring to the country. Public diplomacy is basically the impact that a government seeks to have one of the population of another state with the purpose of influencing the actions of local authorities, and this maneuver is far from being a simple gesture of solidarity or an attempt to expand one of the essential values of the socialist ideology. The impact today this problem represents one of the main pillars of Cuba's foreign policy, as it not only increases its involvement in the international arena, but has also brought the island political and economic benefits. Cuba has used medical diplomacy to conquer both the hearts and minds of citizens of different countries. Medical diplomacy in Cuba worldwide, exposing a beneficial health indicator like that of developed countries, and diplomacy is having impact mainly because countries that require medical assistance from Cuba and medical personnel enjoy all the benefits of starting to be attended by first-class personnel who are specialized in their different areas. We can establish the impact of Cuban medical cooperation as a public diplomacy program through 4 variables: opening of embassies, increasing bilateral and multilateral relations, voting against the blocking, and media impact in favor of a favored Cuban image. In relation to a media impact of Cuba's image, medical cooperation has also had an effect. The analysis of the international media treatment of collaboration in health in the period from 2014 and 2015 showed that the subject is a little threat. However, an objective balance predominates, although with bias and negative nuances for Cuban image. The impact of the good fight and the continuous focus not only in gains but on the international reader, seeking to establish a good international relations and to pay attention to anyone in need, has raised Cuba's prestige in this area.
To continue, we can say that it is effective because Cuba foreign police bring together its principal which a set of diplomatic instruments, including cooperation in the fields of health. Cooperation is a based on axiological system linked to cultural identity and a sense of values correlate to the political, economic, and social system they represent. It is also based on the international law and order. It should bring benefits in many areas of foreign policy and domestic affairs. A circular relationship is achieved between principal and interesting sides of the most recurrent interest of Cuban diplomacy is respect for its principles, including solidarity with the most vulnerable and respect for sovereignty and self-determination. The circular relationship and many other political, economic, and social benefits point the consolidation of Cuban medical corporation as public diplomatic program in the field of building medium and long-term relation. Finally, we can also add that the evolution and result of Cuban medical corporation should be explained first of its interdependence, which the building of the national health system as public policy. Most Latin Americans are aware of the good reputation of Cuban's health system, and now that it also provides medical assistance to the countries, probably including their own. What many do know is that since the beginning of the Cuban Revolution, 50 years ago, the Cuban government adopted a policy of medical diplomacy. The use of the diplomatic, whether of humanitarian ration of the health means of the beneficiary spring over the years.
This has been our analysis and evaluation of the public diplomacy program we have chosen. Thank you for your attention and we hope you have enjoyed.